Hello, everyone. Welcome to Sit Heads Meditation Club. My name is John. I help organize this group. Sit Heads is a sitting and social group for people interested in deep meditation practice. I like to call us a serious meditation group for non-serious people. Everything we do is free and donation-based, and if you want to hang out with us, you can find us at sit-heads.com. We meet every Thursday evening here on Zoom to meditate together and then chat about practice. Usually it's a peer-led meetup, but once in a while, usually once a month, we have a guest teacher join us for Q&A like we have tonight. Let me tell you about our esteemed guest, Dr. Susan Pollak. Susan Pollak, MTS, Ed.D., is a clinical psychologist at Harvard Medical School Cambridge Health Alliance, where she has taught and supervised since the mid-1990s. A longtime meditator, Susan has been integrating meditation into psychotherapy since the 1980s, way before it was cool to do so. She is a co-founder and teacher at the Center for Mindfulness and Compassion at Harvard Medical School, Cambridge Health Alliance. And she was also the president of the Institute for Meditation and Psychotherapy for 10 years, between 2010 and 2020. And if the name Institute for Meditation and Psychotherapy sounds familiar, that's the organization that was founded by our good friend Trudy Goodman, who has also joined us for one of these sessions. Hey, Susan.
Hi. I just want to say thank you so much for the work you're doing. Thanks for inviting me. And I first heard about John because I've been studying koans, and one of my friends in the early morning open temple, we meet at 7 in the morning, put in a link to what I thought was a wonderful discussion with John Sutherland. So that was sort of what got me hooked. And Trudy Goodman has sort of been a older Dharma sister mentor for years, for decades actually, and Sarah Lazar has been a colleague at the Institute for Meditation and Psychotherapy. So I kind of feel like I'm with family here. And John, I just want to say, hats off for creating such a wonderful community. That's not easy to do.
Oh,
So,
thank you very
deep
much.
bows, deep
Oh,
bows.
I really appreciate that. I do want to say that it's also not just me. There are lots of people, everyone participating obviously contributes enormously through their practice, through their presence, through their contributions. And we also have people who are really volunteering their
Mhm.
time, their creativity. So, I'm going to pass your deep bows along to them as well.
Yeah.
And
And of course, it really does take a village and a community. But, I admire anyone who can keep an institute going strong or a
Thank you
community
very
going
much.
strong.
That means a
Yeah.
lot coming from someone who has done that. It seems like a few times.
Yeah.
Um, I'm wondering, just out of curiosity, could you hear my dog whining and yelping, or did Zoom's
No, and I
noise
love
reduction?
puppies. So, um, as we say in internal family systems, which is sort of the hot new form of therapy, all parts are welcome, all beings are welcome. So your dog is welcome. No
Okay,
problem with the noise.
I appreciate that. So the way that we do this normally, Susan, as you know, since you've watched some videos, is you and I will have a conversation for maybe 30 minutes, something like that. And then we'll open it up to Q&A with everyone else who's here. Does that sound okay?
Terrific.
All right. So I've got sort of a grab bag of questions here. I'm not even sure if there's a through line, except that they're all sort of around the intersection of meditation and psychotherapy, which I thought would be an interesting thing to talk about.
Mhm.
So my first question is, and I don't want it to be, um, it doesn't have to be sort of a Q&A. I lob a question, you answer. It's totally okay for it to evolve into a conversation or, however it ends up going. I don't want you to feel like you're in the hot seat here answering my questions. So let me
No
throw this
worries.
question out there as a conversation starter. Um,
Hmm.
why, maybe this is a softball, but like, uh, no, I think it'll be interesting to hear your thoughts on this. Why is
Hmm.
it that a Dharma practitioner or a Dhamma practitioner still needs psychotherapy. I mean, why isn't it enough to practice the teachings of the Dhamma, the teachings of the Buddha? They are put forward certainly as a complete path to the elimination of suffering, right? Free or liberation from suffering, freedom from suffering. So, given that, the fact that meditation is being integrated with contemporary psychotherapy, some might say that there's a bit of an implicit jab at uh, at the Buddhist teachings, or an implication that they're incomplete in some way. So, what are your thoughts on that?
Great opener. So, and it will give me a chance to give you a little bit of a historical perspective. So,
Yep.
way back when, I started sort of seriously practicing with a group, there are a few people who were sort of our guiding teachers. And one of them was Zen Master George Bowman, the other was Lama Suryadas.
Mm,
And that was what they held. And not only did they hold that, you taking any sort of antidepressant was just, there was something wrong with you.
mm,
And then what happened, and this is general public knowledge, is people started getting depressed, including the teachers.
mhm.
And Lama Surya Das actually put it well, and he said, well, man cannot live, or men and women, or whatever gender you're comfortable with, cannot live by dharma alone. So things began shifting, and then teachers started basically speaking their truths, and they said, well, I've suffered from depression, and I've suffered from abuse, and I've suffered from anxiety. In fact, I was just listening to a really wonderful podcast today on Buddhist wisdom, and Mingyur Rinpoche was speaking, and he talked
Mhm.
very openly about how he's had panic attacks since he
Yeah.
was about 8 years old, and how he worked with them. So I think as there's sort of less of a taboo around getting help, people are more honest in terms of what they've suffered with.
Though
But it used to be,
Mingyur
yeah.
Rinpoche did say that it was the Dharma that, like, I don't think he went and saw a therapist, right? I think he did a bunch of retreat.
And he worked with his father. I mean, the interview today, if people want to listen to the Buddhist wisdom um, summit, it's really worth listening to. And Sharon and Tara and Joseph and Jack are on it as well.
Mm,
But I think there used to be a taboo, like you weren't a serious practitioner if you got depressed.
yeah.
And I think that has really shifted. And the teacher I studied with, the Zen master George Bowman, admitted that he had, again, not a secret, he'd been depressed, he'd been anxious, he'd been abused, and he was taking meds. And this was at a major conference, and it was a huge public, statement of, and my therapy helps.
Yeah.
So I
Yeah.
felt like the world turned a little as people started saying, can't live by Dharma alone. And a lot of us are in pain.
Yeah. I really appreciate that. And I mean, as I was asking the question, it was not to suggest that I actually think that the Dhamma should be enough, psychotherapy has no place, but I thought it would be an interesting sort of seed question for us to explore, even though I suspect we think similarly, or
Yeah,
along similar lines there. Um,
it's a great
but
question. So don't beat yourself up at all. And in fact,
not at all.
just,
No,
yeah,
but so it's interesting. It also makes me wonder, um, there's sort of like a survivorship bias, right? Like all the arhats and all the great practitioners in the suttas, maybe they were the ones who didn't have generalized anxiety disorder, or they were the ones who didn't have, like we just know the ones who made it, right?
Right.
We just know the ones that the Dhamma completely transformed and illuminated, but we don't know what shared traits they had that may have made that a viable path for them, right? There may have been so many practitioners who were lost, to not to make it over dramatic, but or who, at least for whom the Dhamma, they couldn't get a purchase with it, um, because some baseline things, weren't being taken care of, or they weren't, their mental health wasn't where it needed to be. Maybe there is a certain baseline to be, the same way that they talk in the Buddhist teachings about, like, you sort of need to have the right, if you're even encountering the teachings, they would say from a traditional perspective, well, you must have quite good karma, right? You need to be born a human, you need to be born this and that. There are a bunch of things that you need to be lucky enough to be born as. And maybe at the time it was, you also need to be, your mental health needs to be, really strong and secure, even without psychotherapeutic support, which didn't exist yet. And maybe
Yeah.
now we're lucky that even those of us, like I'm someone who is very prone to anxiety. I've had experiences of depression, and my experience of it was I lost the ability to meditate. Not that, it was that when I was depressed, um, it felt like being locked out of my house. Like I could no longer
Yeah.
meditate effectively.
Yeah.
And
Good metaphor.
thanks.
Yeah.
I mean, it sucked at the time, but
Yeah.
I went on. Maybe this is an overshare, but I went on medication, and let
Mhm.
me tell you, what it did for me was it let the clouds part just enough. It let in just enough light that I could get to work. And this was for me. Different people have different experiences, but for me, it
Yeah.
was like I couldn't do anything. I was just flattened against the ground. And
Mhm.
with taking an antidepressant, it like let in it just enough of a crack that I could start to practice again. I could explore ways of practicing that integrated with anxiety and depression. I could read the right books. I could go to therapy. I could, and I could do various things around my material condition and my lifestyle and so forth. And that really helped me out and become well again. So at that time, it was
Yeah.
completely crucial for me, and it was like, yeah, I just couldn't meditate at all.
Yeah. And let me give you an interesting historical antecedent and also tie that into what we're finding now. So there was something called um, meditation sickness. I don't know if Trudy mentioned this at all when she came to speak to you.
I think
Um,
so.
but my recollection is that the Zen teacher Hakuin, after a Kensho awakening experience, developed this meditation sickness, which some people compare to St. John of the Cross, Dark Night of the Soul.
Yeah.
And Trudy, actually, if people want to look this up, Trudy teaches this ancient practice, which is an antidote to um, the meditation sickness, which is a lovely practice where you just imagine that there, and I guess this comes from India. You imagine that there's some warm butter on the top of your head, and it slowly melts. And as the warm butter melts, it brings happiness to your entire body. And she'll spend 30 minutes or so guiding people through this. So that's a good resource. The other piece of information that's interesting is more and more people began to report having what we call adverse reactions during long retreats. And the
Yeah.
person who started studying this is Willoughby Britton at Brown. And she
Sure.
started a foundation to look at that. So now a lot of retreat centers we'll make sure that there are people at the center who can help if
Yeah.
you have a depressive episode. So it's something that's known now, and Willoughby's research is that it's more common than we thought, especially during long retreats. Something like between 10 and 25% of people can experience an adverse episode. So it's good to know how to respond. And of
Yeah.
course, it doesn't happen to everyone. Um, my sense, being a therapist who sees a lot of trauma and who's worked with trauma for years, is that stuff comes up. I mean, just as we say in psychoanalysis, therapy, you sort of work long enough and hard enough, and everything is going to come up. So people will sit for hours, and suddenly there's a memory of, you know, a brother or a mother or a father who was very angry or abusive. So you, as you all know, you can't sit on that much when you're really doing serious meditation. So I like to think that there's so many ways to work. You don't need to take meds, you don't need to do therapy. Sometimes just having a really good guide
Yeah.
can make a huge difference. So there's no one size does not fit all. And I'm not someone who says, oh, you need to do therapy in addition to meditation. But
Hmm.
just if you're getting in trouble, it's nice to know that there are people who are trained
Yeah. It's good not
in
to rule
helping
things
you.
out, right? Like it's good to keep your options on the table. Um,
Exactly.
yeah. Um, yeah, and also we should give some credit, I think. I wonder if you agree. I mean, I think that like in terms of, Willoughby's work, the research she's doing at Brown, Cheetah House, the organization she started that's sort of like a refuge for people dealing with adverse
Mhm.
meditation related effects. I think we also have to give some credit to the meditation teachers Daniel Ingram and Kenneth Folk, who, while they
Mhm.
are controversial in some ways, one thing they definitely did, I think, was put a big spotlight, at least in like the sort of online meditation zeitgeist, on this occurrence of uh, effects, symptoms, experiences, whatever. And I think they really pushed back on what they saw as a widespread, sort of misinformation that meditation is always going to be cozy and pleasant and safe and easy. And
Yeah.
I think they really pushed back on that. And I think Willoughby was I think that my understanding is that she was influenced by sort of them and their scene, and it led to her doing, sort of real scientific, research, controlled studies, the whole thing. So I just wanted to give like a quick shout out to Daniel and Kenneth for that. Uh, they deserve some flowers. Um, and let's see. Okay, I have some other random questions. Now that we've established that psychotherapy is a good thing and that
Mhm.
meditators might still benefit from it, um, let me just ask some random questions, okay? Um,
Okay.
all right. Uh, how do you deal with the how do you square the integration of meditation techniques pulled from Buddhism into modern psychotherapy when their aims are so different? When the traditional Buddhist teachings are aiming toward awakening, enlightenment, liberation from suffering as understood in a particular way, right? As liberation from the pain of craving, essentially.
Mhm.
And that is not necessarily a trip that these patients are looking to go on, right? They want to be a little happier, a little less stressed in the conventional sense. They might want to find a way to relate to the things they crave in a different way, or get more of the things that they crave, but they haven't necessarily signed on to the Buddhist project. So
Right.
aren't there complexities around integrating Buddhist techniques. If you do so much of the sort of mindfulness stuff that's integrated into psychotherapy, as I understand it, comes
Yeah.
from um, comes from essentially sort of vipassana techniques. And
Mhm.
if you do vipassana deeply enough for long enough, intensely enough, you're going to have some very Buddhist experiences that these
Yeah.
people might not necessarily want. So, how is that looked at and how is that handled
Yeah.
in the
So
psychotherapeutic context?
this is the way I think about it, in that they're not, there's a spectrum, but they're not that far apart. So most people come into therapy because they're experiencing suffering of some
Mm.
form, and they're looking to have a cessation of suffering. One line I like from the ancient Indian suttas is, looking for iron, he found gold. So, one of the things we're hoping as Buddhist oriented therapists is you start out learning the techniques to sort of help with anxiety or help with the depression or help process grief. I mean, so many people come to therapy just wanting help with the basic painful aspects of life. And then it's sort of like, this really makes a difference. This really helps me lead a more fulfilled life. So people may come craving or feeling pain of the end of a relationship and then realize that, I was looking for everything in that relationship. And life doesn't work that way. So I wrote a book with some friends called Mindfulness and Psychotherapy, and actually Sarah Lazar and Trudy were authors. And we have sort of a spectrum of how we look at it. So there is what we call, mindfulness oriented therapy, where, or mindfulness based therapy, where the client will come in and the therapist won't explicitly talk about Buddhism or meditation, but will just model some caring, some compassion, some mindfulness. And that's it. And then it can go more deeply. And a lot of this incorporates cognitive behavioral therapy, where you actually teach some of the mindfulness techniques. And so that's sort of mindfulness oriented or mindfulness based therapy. And the third step is where you really bring the mindfulness and compassion into the office or the Zoom room, and you can practice together. So there's, again, a whole spectrum of different ways it can be used depending on what the person wants. So again, not one size fits all, but really seeing what you need.
Yeah. Um, the idea of they came looking for iron and they found gold. So there's a sense in which you, as a Buddhist influenced therapist, you do sort of buy in the way that I buy in. Like you buy into the fact that, craving and clinging and grasping is generally speaking going to make you less happy, not more.
Mhm.
And so without pushing that as an agenda, you offer them methods that will inevitably confront them with those realities so that they could see it for themselves. Is that kind of the idea?
Yeah. But I'm really, really gentle, because I've made, some mistakes as I was starting out. And when we all sort of started doing this in the 80s, and as Jack Cornfield puts it, we were, doing it without adult supervision.
Mm-hmm.
So I remember someone came into my office. It was like our first session. I had just done a meditation retreat or something, and I was so excited to, you know, talk about the retreat and what I'd learned and help her because she was dealing with anxiety. And I mentioned meditation, and turned out that her mom had left the family when she was young to go find herself and go to India. And it was the last thing in the world she wanted. So our first session was our last session.
Hmm.
So I became very careful about what I said, and then as we're taught, you get a good history, and you find out what the person's looking for. You don't just say, oh, this meditation will really make a difference in your life.
Yeah. Yeah. Um, so going back a little bit to this idea of these sort of destabilizing meditation experiences that can happen, these adverse,
Mm-hmm.
maybe adverse is the wrong word, because depending on your paradigm, you might look at those as necessary experiences along, as along the path. So it depends, but either way, they're not fun,
Mm-hmm.
and they're difficult. So I think we could all agree on the, we know the sorts of experiences I mean. Um, I have heard this idea. I've heard it from Willoughby. This idea that I say that like we're buddies. We don't. She doesn't know me from Adam, but I've been to a talk that she
Mm-hmm.
gave. Maybe we'll have her here sometime.
You
Um,
should.
but but she talked about how, the idea of not having someone on a retreat who's trained to handle these things, and ideally a clinician, right, a trained clinician, um, is in some ways dangerous and maybe even sort of negligent.
Mm-hmm.
Um, and so I guess my question is then, even in therapy, even when someone's not on retreat, it is possible for someone to trip and fall into a wild meditation experience or a
Mm-hmm.
very destabilizing meditation experience. It doesn't happen often, but it's happened sometimes. The first time someone sits down, they get into a very weird place. They have a very powerful, very destabilizing insight experience, or bunch of old trauma comes up. There are a bunch of ways that it could be
Mm-hmm.
difficult. But it sometimes happens totally unexpectedly with
Yeah.
beginners. So, Willoughby was saying, like, there should be clinicians there. So when you're doing psychotherapy, there is a clinician there, the
Yeah.
psychotherapist, right? So what do you do how do you place guardrails or safeguards around the practice to try and prevent or at least minimize the chance of that happening? Is it actually even possible to prevent that from happening? And then if it does happen, what do you do?
Great question. And let me respond two ways. The first is on my very first long retreat, I think I was 17 or so. Um, Someone had a psychotic break, and I don't know his history, I don't know what happened, but there was, one day this person was, actively practicing with us, and the next day something had happened and people were pushing him around in a wheelbarrow. And I thought, oh my God, what happened? And that was before anyone was talking about this. So that was dramatic for me. And I often wonder, like, what happened with him? And what you can do, not that you can put up guardrails, but you can be you can be a lot more skillful. So again, another story, I was working with someone, we had just started, and we didn't know then, this was early 80s, to take a trauma history. So this woman was anxious, she had a job interview coming up, and I thought, oh, let me teach you a basic breathing technique. So I started teaching her this breathing technique, and she immediately went into a panic and had a memory of something very scary happening. And she started hyperventilating. And it was like, oh my God, what's happening here? And again, this was before we really knew anything about trauma. And what you do is you sort of say, okay, in Buddhist language, this was an experiment. let's stop it here, let's sit together. And I helped, talk her down. And then, the next few sessions for a while, we're talking about the history that she hadn't remembered. And I think even if I had known to ask, it wouldn't have made a difference. But luckily, what made the difference, and she didn't say, I'm out of here, you're stupid and incompetent. We had enough of a relationship and enough trust. So it was, I apologized, of course, and we continued. But it's sort of just like life, you never know what's going to come up. So you may be sitting and you may have a memory that's very disturbing. And what you want is a kind enough, skilled enough therapist who can get you out of that situation.
Mhm.
And that's why I believe it's good to have a clinician at retreat centers.
Yeah.
So if you get in trouble, there's someone to say, I'm here for you. We can take care of this together. You're not alone. And that's another point. I know you haven't asked this question yet, but I think a retreat in community is a lot safer than going off into the mountains doing a solo retreat. Because if something comes up, you're alone.
Yeah. 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 And there are actually stories, bad things have actually, really bad things have happened. Um, and I say that as someone who has had very, very fruitful solo retreats.
Yeah.
Um, but yeah, I could definitely see how uh, the risk is increased for sure. And so that
Yeah.
makes sense in terms of like understanding at least taking a person's history, because it can happen to anyone, but it's likelier to happen for some people than others, right? So there
Right.
are reasonable risk mitigation efforts that a therapist can make.
Right.
So that makes a ton of sense.
Yeah.
Um,
And one thing that Willoughby argues in her study is that she's seen these adverse effects, or whatever we want to call them, in people who have no history. So,
right.
which is, for those of us who think it's a logical progression, it just makes you wonder, like, okay, what's happening?
Yeah.
What's happening?
Yeah. Let's see, what else did I want to ask you about? Um, oh yeah, I one thing that's sort of interesting to me is that meditation and psychotherapy in some ways makes for strange bedfellows, because
Hmm.
most forms of meditation, not all of them, but a lot of them, I would comfortably say most of them, involve essentially largely disregarding content, your mental content, your narrative, your story. A lot of it's about seeing story as story and sort of not being ensnared in it, and usually not taking any particular interest in what the story is,
Yeah.
right? And then, of course, psychotherapy, at least many of the modalities of psychotherapy, um, obviously involve engaging deeply with the content of the narrative, of the story, and even intentionally constructing narratives, and identifying patterns, and so forth, right? Whether you're talking about, psychoanalysis or psychodynamic therapy or cognitive behavioral therapy. And now the lines are a little blurrier than all that, right? Because to do CBT effectively requires some sort of mindfulness to even notice that there's a thought that's arisen, right?
Hmm.
And then in contemplative traditions, there's still awareness of whether thoughts are wholesome or unwholesome, and there are aspects where you are paying attention to the content, other
Hmm.
aspects as well. But I would say, painting with a broad brush, there is this distinction, right? So how do those two things fit together? Do they bump up against each other? Is it better to sort of do one at a time? Do they integrate smoothly?
Hmm.
Um, yeah,
Okay. So let me respond to that in that it's very nuanced, and the world of meditation has
Oh,
changed.
you mean you can't just answer it in a 2-minute soundbite? That's
I
really what I'm
will.
here for, Susan.
Okay, okay.
No, I'm completely joking.
I
Please
know
go
you're
ahead.
teasing me. Let me be as pithy as I can with fewer shades of gray. So, so,
Yeah, if it
but
can't be a tweet, we're not interested.
yeah, no, we like some depth. So, in terms of meditation, and I was actually listening to a really interesting talk um, by Joseph Goldstein, who was really sort of rethinking what helped. And one of the things he was talking about was the importance of insight. So, classic story where you're walking down the street and you fall into a pit, you take yourself out, you walk down the street again, you fall into the pit. You get a little curious about why you keep falling into that pit. And actually, there's a wonderful Zen koan, like, man, wide open, falls into a well. So I think that's a great metaphor. We all fall into wells or pits. What's happening? What's what's driving that? So I think that in many ways, by focusing more on insight, um, there are times when you need to think about behavior or history. And in terms of therapy, a lot of therapists now, especially those who are sort of less psychoanalytic and more focused on cognitive behavioral, will say, okay, you've told me that story, I'm just making this up, 20 times. Like, why are you getting stuck there?
Hmm.
The person might say, oh, well, I just can't get over what happened with my mother or my brother or the way they were treating me. And I'm so deeply hurt. And then you look at, okay, what would it take to lighten that load? Would you want to try some metta practice? What about compassion or self-compassion? So I think there's an elegant interweaving, especially if you have a therapist who loves both forms of healing.
Hmm.
Because some people really need that loving kindness or, that metta, because they've never
Yeah.
had that. There's one great, Sharon Salzberg may have said this with you, and people have asked her, like, do you think the meditation helped you reparent, or your teachers help you reparent? Because she had
Hmm.
a horrendous history of trauma. And she said, absolutely. My meditation helped me reparent. So I think as we're all growing in knowledge and understanding and depth of training, um, the lines are not quite as clear.
Hmm. Yeah. Um,
Sorry, that wasn't a soundbite.
yeah, no, too many characters. Can't
Yeah.
post that.
Okay.
Um, no, it's great. I wanna poke at it a little bit.
Sure.
And then in like 6 minutes we'll switch to Q&A.
Okay.
But I wanna I wanna poke at that a little bit. So let's say that I'm having a really painful and anxious thought.
Hmm.
There are a bunch of different options for what one might do, right? And
Yeah.
I can't name all of them, but some of them are, if you're in psychoanalysis, you might dive really deep into the potential roots of why you're feeling that way, right? What does it say about your past, and what does your past say about it? Um, and you might try to really untangle that thread. If you were um, if you were doing cognitive behavioral therapy, a therapist might point out that that thought is a fortune telling thought, or it's an all or nothing thought. It's a catastrophizing thought. If you look
Hmm.
at what it's saying, it's distorted in these various ways.
Hmm.
And then if you were doing a more mindfulness oriented practice, you wouldn't do any of those things. You would just notice that it is a thought. You wouldn't care if it is the thought distorted or is it realistic. What does the thought say about my childhood? I don't care. It's a thought. It's a mental object. You like wouldn't even go there, right?
Yeah.
Um, and then there are other things. Maybe if you're a Dzogchen practitioner, you would just rest back in
Yeah.
the unborn, self-arising, awakened nature of all things.
Yeah.
But so it's like you've got these different tools and they tell you to do different things. Sometimes they tell you to do
Great.
opposite.
Great. I just have to tell you, your timing's perfect because I was working with someone in supervision, and just so people know, therapists in training, even if you're not in training, um, are pretty much required to get supervision because people are so important. We want to make sure no one gets hurt. So she was saying, well, I could try this theory or that theory or that theory or that theory. Where do I go? And my response is, it's okay to be practical. What's going to work? What's going to help this person really shift that anxiety around? And that is why it helps to really know your client. And for some people, Joseph was recently talking about his history with fear. And he said that shifted for him when he realized, well, I hate this fear, but I could live with it for the rest of my life. And then it began to
Mm,
dissipate. I've heard other teachers say, well, this is the way it is. Or Tara Brach will say, this too belongs. So often when we resist, I shouldn't have this anxiety, something's wrong with me, it's all my mother's fault, I'll never get rid of it, rather than, yes, this too. So, and then it's fine to do trial and error. You may not get it right the first time, but at least if you try, ideally the person you're working with will give you some credit for effort.
yeah,
Um,
yeah,
yeah, so I wish there was one size that fit all, and there
of
isn't.
course, yeah.
So,
There isn't. Yeah, fair enough. Okay, I have one more question for you, and then we're going to open it up.
sure.
Um, I want to talk to you about the tyranny of mindfulness-based stress reduction. And that, I mean, I'm saying that in a provocative way, but
Yeah,
I know that the Center of Mindfulness and Compassion at Harvard Medical School, Cambridge Health Alliance, which you co-founded, is a research institution among other things.
yeah,
And whenever I read, I'm not a scientist and I'm not a researcher, but every now and then I'll come across or I'll pick up sort of a paper on some meditation study.
yeah,
And shock of shocks, it's always in an 8-week protocol with weekly 2-hour meetings. Like, this is MBSR. So
yeah,
why is everything ever, I mean, surely there's another way to teach meditation in clinical settings than this thing that John Kabat-Zinn cooked up as what, like a 20 something, a 30 something in the 70s. Like, it's like he was the first guy to do a clinical meditation thing, and then no one's thought of anything, or everyone feels hemmed in to use his kind of arbitrary,
yeah,
at least to me, protocol. I know there are many things about it that are non-arbitrary,
yeah.
but like, it's 8 weeks. It's not 10 weeks. It's not 4 weeks. It's 8 weeks. It's you do it like this, you do it like that. It's this long. It's taught in this way, and everything is like some MB whatever. You've got mindfulness-based cognitive
Cognitive
therapy for
therapy
recurrence of depression, and that is an 8-week weekly
or
protocol. It's
recovery.
obviously modeled on MBSR. You've got the various sort of compassion training. I mean, I think one of them is more grounded in Tibetan teachings, but the
Yeah,
other one that's more grounded in
the one
metta,
at
I'm
Stanford.
pretty sure it's an 8-week protocol.
Exactly, and I
What's
help
what's
create
up
that.
with this?
Okay, I am totally with you. And I have asked that question as well. What it comes down to, especially if you're in a hospital, is what is evidence based? And John was smart enough to start publishing the data in like 1980. So if you want insurance to reimburse, they want the evidence base, and the evidence based is 8-week courses. We try sometimes 6-week courses, sometimes 10-week courses, but yeah, we're bound, or hospitals are bound, if you want to use insurance and get reimbursed, to follow the research.
But
But I'm
even
with you.
when doing the research, though, why is all
Yeah,
the research itself around that? I mean, Kabat-Zinn didn't have precedents to point to. He blazed a new trail, but now I feel like everyone's sort of blazing sub trails of Kabat-Zinn's trail. Why is
exactly.
that?
I just think it's the way research works, especially in a hospital setting. So I know, being somewhat argumentative myself, it's like, why do we need to do 8 weeks? What about 4 weeks? And why do people need to meditate? I mean, he originally said 45 minutes or an hour. People were hating the body scan. And then Judd Brewer, you may know, you probably would really like to have him on,
We
has
have.
come, okay, good, has come up with informal practices, short practices that are as effective. So I think, as the research deepens, as practice deepens, as we get smarter about what's really happening in the brain, um, we're not going to need the 8-week courses. I mean, a lot of
Mhm.
people find that tedious. Meditating for 20 minutes will be seen, or 12 minutes, Amishi Jha does 12 minutes, will be seen hopefully as effective as, the 45-minute body scan. So
Yeah.
the field's trying to move away from that, but right now that's considered the gold standard.
Hmm.
And when you're
Yeah.
creating things, you follow the gold standard.
Yeah. There's sort of a path of least resistance there. Um,
If
okay.
you want to get it accepted, because we were trying to put together new programs, and I would say, how about this? How about this? And it's like, well, it's not evidence based. So
Mhm.
generally, what it comes down to is it works for a lot of
Yeah.
people.
Okay. And nothing else will be evidence based unless people decide to try and gather some evidence.
Well, no, no, and that's one of the things we're doing at the center. So
Yeah.
we've put together these new programs. Some of them are 4 weeks and 6 weeks on primary care. Like, let's say you're dealing with heart issues, diabetes, high blood pressure. What can you do that's going to make a difference?
Hmm.
Or what can
Yeah.
you do for recovery? So anyway, that's the world of research and getting insurance to cover treatment.
Yeah. And look, it's a world that I stand outside of, so it's very easy to throw tomatoes from all the
Yeah.
way over here. But I was curious because it's something that I've noticed. And there, by the way, there goes our chance of ever getting Kabat-Zinn to come talk to us. But that's okay. Um,
I'm not sure he's going to listen to this.
no, I suspect he might not watch this video.
Yeah,
But okay, well, this was really great, Susan. I've monopolized your time long enough. Let's open it up to Q&A. Does that sound all right?
that sounds great. And I enjoyed it. I like
Yeah,
to
me
spar.
too.
So
This
this
was a
was
lot of
fine.
fun.
Yeah.
Thank you for tolerating my exuberance at
I,
times.
I think it's great.
Okay. All
Okay.
right. All right, gang. Let's do this. So to start, um, okay. Ruth, would you like to ask your question?
Yes, please. So I actually know John, and he's lovely. And my question is about John Kropp's version of meditation and how that interacts or doesn't interact well with psychotherapy, and with different styles of psychotherapy. So my question is about the getting it right part in terms of dealing with one's own life. You can't. And if everything is focused on what's the right thing to do, then whether it's psychotherapy or meditation, I have found it in my life very unproductive. So have you looked at like the cultural context of this getting it right Theravada meditation,
Yeah.
especially?
First, Ruth, welcome.
Thank you.
Second, I love that question. So, one, I agree that so much of how we're approaching it has to do with our culture. And again, as someone who loves Zen, um, I love that sort of, in some ways, your Tibetan kind of crazy wisdom. So there's a saying that's wonderful, which is life is one mistake after another. You just can't get it right. No matter how hard you try, you can't get it right, or you can get it right once and then the next time it isn't. So I think that is the
Doesn't
nature.
Buddhism say there's no right?
Yeah. But so some of it is, at least Zen does. But I think some of it is that we're so bound by this culture. The cultural norm is, get it right, achieve, don't make a mistake, fall down, pick yourself up, where um rather than just saying, nothing works all the time, and you can't expect it to. Um, there's a saying that I really like, which is, I was listening to, you can tell I spend all my spare time listening to Dharma talks. This was a, a Thai monk who was saying, it's not supposed to work. Samsara does not work. But I think you need a certain wisdom and a certain amount of living to be able to say, you know what? That's just not going to happen. The nature of samsara is you're never going to get it right. And better to have a sense of humor when things go off the rails.
Mm-hmm. Yeah, and I watched people have catatonic episodes and psychotic breaks at Upandita's retreat in 93 at IMS
Oh, wow.
because it's always work harder
Yeah.
and it's no support. And I actually I was working with Sharon and Joseph, and I
Mm.
asked them, is this how it was in Burma? And Sharon especially said, no, we did our own laundry, we showed people around. So the absolute, this is the only thing you're doing
Yeah.
is like an American improvement
Improvement with guts. I love
on,
that.
on the
Yeah.
Burmese stuff.
Yeah.
They had community, they had support. The monastery was a family. So even if it wasn't officially psychotherapy, it was certainly, a treatment of a person more than administering the rules and telling them to work harder.
Yeah. And also, I love the fact that real life was interspersed. So,
Mm-hmm.
Sharon said we did our own laundry. We showed
Yep.
people around. It wasn't just sitting 24/7.
Yeah.
Thank you so much for sharing that.
Thank you. And I just would hope, because I've seen so much harm from that kind of rigidity and always getting it right and working harder, that that there's more source of compassion and kindness and inclusion in whatever kind of teaching I go for anyway.
Yeah. And let me just add something, again, indication that we're softening a little in terms of what we're teaching in our theory. In the mindful self-compassion um, teachings and theories, one of the um, guiding principles is to allow yourself to be a compassionate mess. So you don't have to keep
Yeah.
it all together. You don't have to be perfect, which I think is, so American, so oriented toward achievement. But it's okay to be a compassionate mess. Where I think so many people, and this, John, goes back to one of your questions, people come to meditate because they don't want to be a hot mess. They want to have everything together rather than thinking, well, wait a minute, I'm never going to be together.
Thank you.
Thank you. Pleasure to
Thank
talk
you
with
both.
you.
Thanks so much, Ruth. Let's see. Uh, Bijan, would you like to ask your question?
Yes.
Welcome.
Hello. Thanks so much. So my question is, so someone who, let's say, feels like they're at a good spot mentally, they do meditation on a daily basis. Is there space for psychotherapy or just um, psychoanalysis as almost a way to like self-actualize? Like you're not trying to sort of get out of a traumatic situation, or maybe let's say you're not aware of it or anything. Nothing feels like it's holding you back, but maybe you want to like, maybe I can take this extra energy and self-actualize or move closer to goals that I want to. And so my question for you is, for someone maybe in that state who's already very into meditation, is there a kind of psychotherapy that vibes very well with that or is like more recommended?
Yeah, absolutely. So, what I'm hearing is things are going well, but is there a possibility that things could be deeper or better or um, feel more connected or happier? And the one of the most popular therapies right now, which I think you might like to research, is called internal family therapy. And it was started by a psychologist named Dick Schwartz. Um, and it's unlike any other therapy that has been done. And in fact, it's based more on meditation and shamanic healing, more on indigenous forms of healing. And there's a ton of stuff online, internal family systems. Check it out. But what happens is you look at things again that are subtle and nuanced. Let's say, for example, you're having trouble in relationships, or relationships haven't been quite as satisfying, or your work is not quite as satisfying. And you may just want to do some work on that. There may be something in your family history, there may have been a divorce, there may have been some wounding in a previous relationship, and you're curious about what's going to come up. Because often, and there are these newer therapies now that really look at the body. So, so much of therapy used to be this sort of Cartesian mind-body split. So therapy was up here, and we didn't pay any attention to the body. But now, more contemporary therapies would say, okay, I'm just making this up. Bijan, where are you feeling that pain? Where are you feeling that sadness? And you may want to say, well, in my heart or in my belly. And then we would explore, okay, what is your heart? What is your belly wanting you to know? So it's almost like you go into a meditation, and this is how the two fields are coming together very deeply. You go into a meditation to sort of see what's there, to get to know it, to befriend it, just as we can work on befriending difficult emotions. So I think that is the overlap in the Venn diagram, where you can go more deeply, even if you don't feel like you need it right now. It's just another form of exploration. Thanks.
Thanks, Bijan. Thanks, Susan.
Sure.
Um, So I wonder if you could clarify something for me about internal family systems, which I haven't practiced, but a lot of people I really respect,
Mhm.
including therapist friends who are trained in it and non-therapist friends who have benefited from it, really endorse and like and recommend it. And I read about how it's, I've heard it said that it's very Buddhist in some ways because it talks about how we are all essentially composite beings with these different parts that sort of talk to each other. But then there's also, I read about how it does say that beyond all of that, there's this thing called self, capital S, self, that is sort
Yeah.
of like the real you
Yeah.
behind all those parts. That part seemed like it diverges a bit from Buddhism, which obviously does not, it's not like something isn't Orthodox Buddhist and away with it. But I'm just curious how it integrates, or to what extent that does seem to you at odds with Buddhism,
Mhm.
or the Buddhist approach,
Yeah.
versus the extent to which maybe it's just a question of terminology and they're actually not saying different things. Curious for
Yeah.
your thoughts on that.
Okay. So, I trained with Dick Schwartz, and
Mm,
he has been really grilled on that point, as has Chris Germer and Christian Neff, because they call it self-compassion. And it's like, wait a minute, you guys are Buddhists. Why are you saying self-compassion? And Dan Siegel will say, well, you should say inner compassion again. My take on this is for people who've been trained in the Indian tradition, Atman, self, is another way of talking about integration realization. That said, arose by any other name. So I think what we don't want to do is get hung up on the problems of language because it's
yep.
it's hard to express. Um, so when Dick gets pressed on this, he says, "Well, what I mean by self is basically what you call no self."
Fair enough. Okay.
And I guess to talk, for people, when you're trying to sell your system, I mean, on one hand, we have, how you sell evidence-based, therapy to an insurance company. I think if you try to sell a therapy model and you call it no self, a lot of people are going to say, wait a minute, no self, that's kind of scary.
Yeah.
So
Mhm.
my guess is it's sort of a marketing ploy, but yeah, I mean, I see it. Dick actually knows more about Buddhism than we'd realized, and
Mhm.
he's actually um, very skilled in talking about it. There was a recent, not that recent, 5 years ago, 4 years ago, conference with Lama Willa Miller, who's now Willa Blythe Baker. She's taken her old name. She's a wonderful Tibetan American Lama who's written a lot. And it was a very interesting conversation between Dick talking about internal family systems, Lama Willa, and John McCratsky, who you may know, who's also a Tibetan teacher, talking about differences and similarities between the two systems. And what it came down to is the systems between Tibetan Buddhism and internal family systems are actually quite compatible.
Mm, okay.
So
Interesting.
a very colloquial way to put it is, as someone who's practiced IFS therapy and have been with an IFS therapist, is it's a way to let go of, and this is going to sound very Buddhist, what's binding you. What's getting in your way. So I think of it as creating space, as really clearing, creating spaciousness, opening mind and heart.
Yeah.
And often doing it through the body. What are you holding? What's stuck?
Well, now here come a bunch of questions. Great. So yeah, that's interesting. I appreciate that. I do think there's a difference, to my eye, between the self, the capital S self, in internal family systems and asking questions about that versus being like, why are you calling it self-compassion? That seems quite nitpicky and semantic. Like, obviously they don't mean self-compassion meaning your eternal, unchanging,
Yeah.
essential self. That's like very silly. That's like being like, well, if you don't have a self, then how do you know which car to get into when you leave the grocery store? Like, come on, like,
Yeah.
like self-compassion, compassion for this ever-changing, impermanent process. That just doesn't roll off the tongue quite as easily as self-compassion, does it? But that's interesting. That's funny that people would get on Neff and Germer about that.
Oh, and just in terms of sort of what goes on behind the scenes, Germer and Dick
Germer,
Schwartz
excuse me.
go back and forth and argue about their systems with each other.
Yeah. All right.
And also the other thing, just one last point, is it's very different to go through it than to sort of discuss the theory. So, I mean, just as you can't really know what it's like to play tennis or ride a bike until you've done it, it's hard to really know what it's like until you go through that experience.
Yeah. Giving my own admonition to keep questions practical and not theoretical right back to me. And I think very appropriately.
I didn't mean it that way.
No, but I know you didn't, but
yeah.
It's well taken. All right, Rick, do you want to ask your question?
Sure. Hello. Thank you for being here.
Hi.
It's going to be scattered, so just take it where you will. I'll keep it concise. Yeah, in therapy recently, one insight that came up was this lack of valuing and giving attention to like negative emotions when I was a kid, a lack of feeling like sadness was valued or worthy of exploration, or allowed to be expressed, especially publicly. And out of that, the insight that came out of it was, well, yeah, what did sadness have to teach me back then, and what might it have to teach me now? And as soon as I started thinking about that, I was like, wait, I don't feel like I value joy that much either, or really ask that question about joy. And so, standing here, having not done much with those insights yet, I'm just curious about your thoughts of where one could go.
Oh, just really resonating with that in a compassionate way. There's so many people who come into therapy saying, I wasn't allowed to be sad. In my family, we could be angry, but we couldn't be sad. And then, when you explore that, a lot of families that I see don't want intense emotions. And my sense of that is a lot of families don't want it because it stirs up unresolved issues. So Carl Jung had an interesting and I think profound comment where he said one of the greatest burdens on a child is the parents' unlived lives or unprocessed lives. So what I generally see in families is, and just resonating, my dad was like that. So if I was sad, he would say, get rid of that sad face. Don't walk around with a sad face. So the difficult emotions are usually not seen. And, you wonder, okay, so what was going on? Because you can't really, when you're a kid, you can't necessarily say, what's going on. Is that left over from, being in the Battle of the Bulge in World War II? Is that left over from suicide in the family, from, a parent's death. And also, if you're just allowed to sort of be here, like not too sad, it often corresponds that you're not allowed to be joyful either. So a lot of kids grow up feeling that they're in a box. And that's one thing that therapy can really help with. Because when you realize, oh, I can't be sad, I also can't be joyful. Only thing I can really be is angry, that's gonna put you in a box. So just know that you're not alone with that. I think when people really start digging, they realize how much wasn't allowed in the family system and in the culture. The teacher Sebene Selassie, and John, I don't know if you've had Seb on, but she's a wonderful, wonderful meditation teacher, will quote a line from Krishnamurti saying the thoughts you're thinking are actually society's thoughts. So don't blame yourself. This is what you've inherited from society, which I think is really powerful. And she talks about that in terms of attitude toward race and gender and all sorts of things. But I'd suggest her as a speaker, John. So was that helpful?
Yes. Thank you.
Okay. All right. Blessings.
Thanks, Rick. Let's see. Eva, do you want to ask your question?
Sure. Hi, Susan. Thanks for being here.
Hi, Eva. And I like going with the nice car.
Yeah, I mean, like, what other option do I have?
Yeah, that's funny.
So my question is, so you spoke about IFS, which I think is really interesting, and I know that there's some CBT exercises that you can do at home without a guide, without a therapist.
Yeah.
Are there any IFS exercises that you might recommend, in conjunction with meditation or just on their own?
So actually, I've been doing IFS for about 20 years now, and there are a bunch of really good books that have come out, as well as there's a lot online. So I would Google it, but just so you can get a sense of where you can read. Dick has an introductory guide to IFS where he explains the parts, he explains what he calls firefighters and managers, and these are parts that help us survive. So that's sort of a good basic one. And then there's a new book now on, he has a few books on trauma. There's a book that just came out a few months ago on shame and working with shame. And that's by Martha Sweezy, who's one of his colleagues who has written a number of books. Then they're collected essays. So I would just, Google it and see what appeals to you. And maybe just, the other thing I love is watching him work. I mean, he is like so amazing in terms of timing and how he helps people uncover traumas and really free up. So I would see, maybe start with a video, and most of them are named, that you might just want to watch. And my feeling often is that, this is going to sound very Buddhist, we heal together. So sometimes just watching a video of someone healing from trauma can be enormous. He has a bunch of videos, people healing from war trauma, in Afghanistan, or, traumatic childhoods. And rarely do I watch a video of his without feeling lighter and freer. So yeah, I would start there. Thanks for your question.
Thanks, Eva. Thanks, Susan. So we have a question that has been sent to me to ask. Non-self is a difficult enough concept. How are self and non-self the same? I think that was sent in response to our discussion of IFS just a moment ago, and the idea that the capital S self is, he said that it's the same as non-self. So I think that's where this question comes from.
I think we would really need to get Dick on to explain it. At some point, when people start arguing about self and non-self, I just kind of because I'm sort of practical, I throw up my arms and I say, this is just semantics. Is this really gonna help us feel better? But it's a good question. And it's like, wait a minute. If you're really talking about non-self, why don't you just say non-self, rather than self? So I'm with you on that, John.
Okay.
I'm sorry, that wasn't very helpful. Okay. Richard Schwartz, otherwise known, I'm just responding to your question, Rick, otherwise known as Dick Schwartz. And if you just Google internal family systems, you can find it. Oh, thanks. Thank you, everybody, for helping.
So, Susan.
Good community, I can tell.
Sorry, what'd you say?
I said good supportive community, I can tell.
Yeah, good folks, for sure. All right. So thank you so much, Susan, for being here with us. I enjoyed this conversation enormously. I'm so glad that you reached out and we got to know each other and we got to talk to each other in this forum. And I'm really grateful for the Q&A. It was wonderful. We got a question at the last minute, but it's a little too late. I'm so sorry. We're just wrapping up. So I want to apologize to the person whose question we weren't able to get to.
John, if it's okay, I will try to answer it in 2 minutes.
We can do it. I mean, people are welcome to go when we get to 9 p.m. Eastern if they really want to, but sure. Let's do it then.
Sure.
I think it's saying that I can just ask. So, okay. I appreciate the integration of meditation into psychotherapy and wonder if there is or might be any effort to integrate meditation training into any psychotherapy graduate programs to more widely spread the knowledge and information about this practice.
Yes. So there are a number of programs that are coming, more current than they used to be. And quickly, a lot of the schools of professional psychology are trying to have therapies that are helpful. And one of the things we offer at our center at Cambridge Health Alliance is training in this. So students are able to train in IFS. In fact, Richard Schwartz has been faculty, and students can get level 1, level 2, and level 3. It's an extensive training to do IFS. So yes, that is accessible, and people are supervising on and teaching these newer forms of therapy. So, okay, 8:59. I think I covered the bases there.
Very efficiently done. Yes.
Okay.
So we'll do our wrap up again. And you got to thank you from the person who asked the question. So thank you so much, Susan. I'm so glad that you were here with us. I'm so glad that we connected and we got to have this conversation, have this Q&A. So let's see.
And I just want to thank everyone for coming. I've had a great time, and John and company, please feel free to use me as a resource. And I'm always happy to give you names of like cool meditation teachers or therapists that you may want to have on the program.
Yeah, and you've already given me a couple that I'm going to be following up with. So I really appreciated that. So
Yeah.
yeah, thank you so much, Susan. This was really great. Any last thing that you want to say before we say goodnight?
Just extending gratitude and thanks, John, for creating this, and thanks for keeping this cool community going. It's needed.
Thank you, Susan. I appreciate you a lot. Thanks for being here. Thank you, everyone, for being here. Thank you for your time. Thank you for your attention. Thank you for your questions. Thank you for your practice. And we'll see you soon. Have a great night.
Okay, thanks. Had a
Bye,
great
everyone.
time. Bye bye.